One of the other things that Dr. Chernoff talked about, he talked about implications, reimagined role for housing care providers. He said, part of the continuum of support, source of functional data. Third thing, accountable for medical outcomes. Can you imagine the phrase 10 years ago, let alone 20 years ago, being said of private pay seniors housing and care operators, accountable for medical outcomes? People would have run the other way from that. So let me now talk about, just as we want a person-centered approach, something that is, we are uniquely positioned, we should be, if we're doing it right, to provide to our residents. How do we avoid, as we also become that setting that produces functional data, that is really managing both chronic health conditions, multiple, and functional limitations, how do we avoid the medicalization, which turns the clock backward, turns people back into patients in our communities? Do you see a risk to that, A? B, how do we avoid it? So we've had the social model, but in that social model, there were many providers who proudly said, I don't do health care. Now we're not just, we're providing care, we're having to provide data on that care, and we're accountable even and going to be at shared risk in some way for medical outcomes. How do we avoid the medicalization of seniors housing and care? Chuck, I'll start with you this time.
Yeah, part of the answer there is I do think there will be some medicalization of seniors housing specifically, especially if you're chasing a revenue stream that is, federal or state oriented. So there is that. There are going to be minimum staffing standards. To me, it's always amazing when I hear new operators come to us and say, hey, we have awake staff in the evening. I'm like, well, I can tell you, if I was putting my mother in a project, I would assume the staff's awake, right? But you still have some of that holdover mentality. But I do think there will be some steps that will be taken, for higher staffing standards. One of the things that Alpha's trying to do is we're talking about accreditation and working with operators to really figure out what are the best practices out there and hopefully professionalize this business because we still are early days in this sector. So I do expect a little bit more of a medicalization, but I think it's just inevitable because of the type of residents that we're going to be caring for. And the risk piece that the states and the feds, they always go back to where's the risk?
Doug?
You provoked, so I just want to
it's my role.
I
mean, this is the last session.
Yeah,
I try to keep people engaged.
I don't see how you avoid that. I mean, the thesis since the mid-'90s when private pay was really introduced with a new model was to create everyone talked about that pyramid approach of pushing people out of hospitals into a lower cost setting. Still exists today. And yet, at the same time, private pay assisted living providers will do anything to hold on to that resident. Home health has burgeoned because of it. And so when you look at the acuity levels in these various facilities that we see today, yes, on the one hand, we try and maximize the attention to the personalization, but the other side, you still have to deal with what Dr. Chernoff had described as multi-chronic issues, not just at the skilled nursing level, but down through the assisted living level. I don't see how, with these federal payments, that you avoid that. At least not for the foreseeable future until the regulatory bodies get this in some sort of order so that people understand exactly what a hospital should be doing and the other functions below in terms of the cost levels, what they can do.
Well, your thoughts?
Bob, you've known me for a long time. When I get provoked, I usually provoke back, so let me have a shot at this. I don't actually think it's that novel of an idea that you're putting out there. I think The fact of the matter is that functional impairment, in my opinion, is synonymous with quality of life or an impediment to quality of life. And so we have been in the business of providing supportive care and assistance with activities of daily living for our residents since the inception of this business in an effort to help improve their quality of life. What their functional impairment is the barrier that prevents them from having maximum quality of life, and it's our job to try to minimize that barrier. So, I mean, from my standpoint, the business should have already been both a hospitality and a healthcare model, and to the extent that maybe more increased operator awareness or more ubiquity in terms of our approach and some consistency across the national platform, then that's a good thing, and it will average the type of care and the credentialing and the services to a higher level across a national platform. But for the most part, I do believe that assisted living operators in particular recognize that functional impairment, whether it be ambulatory, cognitive, or any other form of medical need, is a primary reason what brought the resident into the community, and it's our job to respond to it.